Are you a bit confused? Do I have an SI problem, sacroiliac problem? This is two joints right here. Do I have a lower lumbar problem? This is the L4, L5 segment and the sacrum. They're very close anatomically. We're going to show you how we do these tests in the clinic to try and tell the difference. So this is the distraction test. We're basically putting both our hands across the iliac crest right here. We're pushing posteriorly and we're trying to call it distraction, apply pressure. It should give you the same, the patient should have the same pain that they're coming here for, okay? This is one test. This is the thigh thrust test. If we're testing the SI, we're on the opposite side. So this is the side that the person's having problems with. We're going to basically bring the person's knee up. We're going to rotate over, place our hands on the sacrum, then lean back, and we're pushing down on an angle. We're going to do it 3 to 6 times. We're going to oscillate down, and kind of as we do it, we're going to go a little bit heavier, a little bit more firm pressure, heavier pressure for the course of 6. And what we're looking for is the patient's symptoms to be reproduced with that. The compression test is our next test. This is the patient who's basically going to lie in sideline. So we're going to have you lie on your side, face that way. And we want to apply pressure is the iliac crest right here. Just below there, we want to apply pressure down. And a lot of pressure. You know, these are very thick, very dense structure. This is a dense joint, I should say. Okay, it doesn't really move a lot. Or some people say at all. So we want to apply pressure down. Same idea, about 3 to 5. A lot of pressure. I'm taking my whole body weight on that. Same idea, about 3 to 6 times. We can do that on both sides, but you're stressing the SI joint. I tend to do it on both. Next test is the sacral thrust test. We're going to basically kind of check where the very top of the sacrum is. We want to be in the mid portion of the sacrum. I'm going to move his pants up a little bit. There we go, right, put that there. Apply direct pressure, more like mid-sacrum, like as they call it S3. We're going to make sure right over the top. We'll come down. You have to be pretty vigorous. You got to put a lot of pressure through here. This is a very dense joint. Same idea, about 3 to 6 times. And I like to progressively increase the load. So if they're very sensitive, you don't start out really, really severe and gradually increase the force. And that'll tell us if we have a patient's symptoms that are reproduced, and it's another positive test. This is the Gainsland test. For now, I'm going to call it the G test. What we're going to do is we're going to put this leg up like so. We're testing this side. So we want to maximally bring this hip into what I call flexion, and then put this leg down like that. We're going to apply pressure like that. And then release. Same thing we'll do on the reverse side. So those are our tests for an possible SI joint problem. What's really important is that you look at the lumbar spine as well and clear that. The SI joint problems just aren't as common. You know, the rates vary from 3% to 25% depending on the person. So you really have to look at the lumbar, which is a high percentage of the chance that it's coming from that area, before we immediately assume it's an SI joint issue. It just doesn't happen as often.